Are you a nursing mother and wondering if it is safe to consume caffeine? In this video, I'm going to discuss the facts about caffeine consumption for nursing mothers so that you can make an informed decision. 1. How much caffeine is safe for nursing mothers to consume? The American College of Obstetricians and Gynecologists (SAGOG) recommends that nursing mothers limit their caffeine intake to no more than 300 milligrams per day. This is equivalent to about 2 8-ounce cups of coffee. It is important for nursing mothers to be aware of the sources of caffeine in their diets, as some foods like chocolate and soft drinks can contain high levels of caffeine. 2. What are the potential risks of consuming too much caffeine while nursing? When nursing, too much caffeine can be harmful to both the mother and baby. The effects of too much caffeine may include insomnia, irritability, anxiety, tremors, heart palpitations, headaches, digestive problems, and restlessness in both the mother and baby. Some studies have suggested that excessive coffee intake by nursing mothers may also increase their risk of having a low birth weight baby. Additionally, high levels of caffeine in breast milk can lead to irritability or difficulty sleeping in infants. Therefore, it is recommended that nursing mothers should limit their daily caffeine intake to no more than 300 milligrams per day, about 2 8-ounce cups of coffee. It is also important for nursing mothers to monitor any changes in their baby's behavior after consuming caffeine-containing foods or beverages. If any changes are noticed, it may be beneficial to reduce the amount of caffeine consumed or avoid it altogether. 3. Are there any health benefits to consuming caffeine while nursing? Yes, there are some health benefits to consuming caffeine while nursing. Caffeine has been shown to help reduce fatigue and drowsiness in new mothers, as well as provide energy during the day. Additionally, research suggests that moderate caffeine consumption by nursing mothers may have some positive effects on their baby's development, such as improved alertness and better sleep patterns. Finally, studies suggest that consuming caffeine while nursing may help the mother produce more milk for her newborn. 4. Are there any special considerations for nursing mothers who are sensitive to caffeine? Yes, if you are a nursing mother who is sensitive to caffeine, it is important to pay special attention to your intake of caffeine, as too much can be transferred into breast milk and potentially disrupt your baby's sleep patterns or feeding behavior. If you do experience sensitivity when consuming caffeinated beverages, try reducing the amount of caffeine in your diet gradually over time. Additionally, it may be helpful to discuss any concerns with a healthcare professional, such as a lactation consultant, before making changes to your dietary habits while breastfeeding. Taking the time to monitor your personal reactions to caffeine can help ensure that both you and your baby are getting the best nutrition possible. 5. Are there any common sources of caffeine that nursing mothers should be aware of? Yes, there are a few common sources of caffeine that nursing mothers should be aware of. Caffeinated beverages such as soda, energy drinks, and coffee can contain high levels of caffeine, which may pass to the infant through breast milk. Over-the-counter pain medications such as Excedrin and Midol also may contain caffeine and could potentially be passed to the child through breast milk. Caffeinated teas, including herbal and green tea, also can contain caffeine depending on their specific blend. Additionally, chocolate contains small amounts of caffeine, so it is important to check labels when purchasing these products in order to determine if they are included in the ingredients list. Nursing mothers should always speak with a doctor or healthcare provider prior to introducing any new products that may contain caffeine into their diet. It is important to keep in mind that everyone metabolizes caffeine differently, so it is essential to be aware of individual tolerances when consuming caffeinated beverages and foods. If a nursing mother notices any irritability or fussiness in her baby after consuming these items, she should talk to a physician or healthcare provider to determine if the child has an intolerance. Additionally, it can take up to 12 hours for the body to fully metabolize the caffeine from 1 cup of coffee, so mothers should spread out their consumption throughout the day. 6. What advice would you give to nursing mothers who are considering consuming caffeine? nursing mothers should consult with their healthcare provider before consuming caffeine. It is important to remember that caffeine can be passed through breast milk and may affect the nursing baby. Therefore, it is important to limit the amount of caffeine during breastfeeding or avoid it altogether. If a nursing mother chooses to consume caffeine, her healthcare provider may suggest limiting it to less than 200 milligrams per day. Furthermore, nursing mothers are encouraged to drink adequate amounts of water throughout the day, as this helps remove some of the excess caffeine from their bodies. Additionally, it is recommended that nursing mothers watch for signs of sleep disruption in their babies and adjust caffeine consumption accordingly if problems arise. Lastly, nursing mothers should always ensure they have enough nutritious food for themselves and for nourishing their babies. To conclude, caffeine can be consumed by nursing mothers in moderation. However, it is important to consult with a healthcare provider before doing so and limit consumption to less than 200 milligrams per day. If you're a breastfeeding mother, make sure to pay attention to signs of sleep disruption in your baby and adjust your caffeine intake accordingly if necessary. Thanks for watching. Don't forget to leave us a comment below about how this video has helped you. And don't forget to subscribe for more helpful videos like this one.